Okay, along with doing your skin assessments routinely, your self-skin assessments, and using the ABCDE method for detecting changes in moles in your skin. Also, another preventative measure would be to use sunscreen and limit the exposure to sun during the midday hours, because that's when the rays are the highest. You're already doing a lot to help protect yourself by wearing long sleeve uniform at work and a hat, and make sure you're applying your sunscreen regularly, because this can help protect and it does wear off. A water resistant sunscreen also is a good idea, because if you're sweating, then that can wash the sunscreen away if it's not water resistant.
Okay.
Next, I'm going to look at your hair. We're going to look at all of your hair, so in your armpits and your chest hair and your hair on your head and your legs, and arms also, so all of your hair. If I was not videotaping, I would also inspect his pubic hair, but because we're not inspecting the skin under his shorts, I'll defer that to later. I'm going to get up on the bed with you.
Okay.
And I'm going to be pushing on your hair.
Okay.
So, with hair, when you're inspecting hair, you want to note its quality, distribution, and texture. Sparse hair is seen in hypothyroidism, and fine silky hair is seen in hyperthyroidism. Now, when you're looking at hair, you're going to want to move it every couple inches on the scalp and look for any changes in the hair. Look for lesions, flakes, or parasites on the scalp. And I can see a little bit of dandruff. It looks like there's little flakes of skin, it looks like. Sorry, do you have dandruff?
Yes.
Are you being treated for it?
No.
Have you seen a doctor about it at all?
No.
Okay, that would be something you probably would want to see a doctor for. They may suggest changing your shampoo to help with that. I've heard good things about Selsun Blue helping with dandruff. But you're just going to go through the whole scalp looking at the hair like this. To make sure that there's no lesions. You also can have moles on your scalp as well, so you'd want to look for any moles and let the patient know that they have them so they can inspect them. Because sometimes it's hard to find them on your self-exam. Which I'm not seeing any moles. I do see a little bit more acne up at the hairline. Changes in the amount of hair is a common in aging. And male pattern baldness is also common and normal. Hair also tends to feel a little coarser and drier with age. But any changes that occur over a few weeks or months can indicate a systemic disease or poor nutrition. Now I'm going to look at your axillary or armpit hair. You could raise your arm for me. And we're just looking for any parasites or lesions here. And I don't see any. Can I see your other side, please, sir? Thank you. You also have another mole in your armpit right there. you're gonna want to look at when you do those self-skin exams. And we're gonna look at the hair on the arms. We're just looking for any parasites like head lice. And head lice is easily spread. The client has a child, so daycares spread it in, and in school-age children especially. You also have some chest hair that we're going to want to look at. And again, there's a couple more moles. Do you feel confident identifying your moles?
Yeah.
Good. And if you ever notice anything in your hair, chest hair, your armpit hair, or head hair, you need to let your physician know.
Okay.
We're going to look at the leg hair. Now, looking at the leg hair is especially important because loss of hair in the legs may indicate peripheral artery disease, while changes in pubic and axillary hair indicate a hormonal problem. Next, we're going to look at the toenails and the fingernails. Now, you're going to want to look at the color, the shape, and see if there's any lesions. Nails should be pink with a white ulna, which is a little half moon. Here, it's easier to see. And this big toe is this little half moon. And there should be smooth and firm in texture. And then there should be a 60-degree angle between the nail base and the skin that she has. Longitudinal bands of pigmentation, which is not seen here, can be present in darker skinned individuals and is normal. Now I noticed that on the big toe over here you have a cut. It looks like maybe you stubbed your toe. Can you tell me what happened there?
Trying to walk into the house and I kicked the doorstep.
How long ago was that?
About 2 days ago.
I can still see some bruising. This will be present until the nail grows out, which may take a few weeks.
Okay.
It looks like you also have a cut there where not a cut, where the nail is actually broken. Have you done anything to prevent this from catching or treat it in any way?
Not yet. I've been wearing flip-flops, so.
Okay. You're going to want to make sure, maybe put a Band-Aid over that so it doesn't catch on your socks.
Okay.
And pull off, because it could take some more of the healthy nail with it. And it doesn't look like it completely tore up. So leaving that on there is going to help protect the skin underneath.
Okay.
And your nail will actually grow out from the top because the nail roots right behind the cuticle. The cuticle actually protects it and will grow out, but the skin underneath the nail is very sensitive. We're going to look at all of your toes. We're going to look at your fingernails also. Now, disease in fingernails that's seen in liver disease can turn the nail plate white and make it have a glass appearance. This is not seen in this client, though. Lesions can also be seen in the winter, right along the side from dry hands. And when this happens, I recommend lotion and seeing your physician if they don't heal. His nails look good. I don't see any problems besides with that left big toe. Do you have any questions about your nails or hair?
Nope.
You're going to want to inspect your nails and your hair when you do those skin assessments that I told you about earlier.
Okay.
And also, I almost forgot, when you're doing assessment of the hair, you also want to look at all body hair, which includes the eyebrows. Because little parasites or head lice can get into the eyebrows as well. And also, some individuals will pull their hair out, and this indicates a problem. And a lot of times will pull their eyelash hair out, which this individual has all his eyelash hairs, it looks like. Thank you.
You're welcome.
And that ends the integumentary assessment. I've been doing teaching as we've gone through, but I'm going to remind the client to wear your sunscreen and your protective long sleeves and hat and protective items against the sun. And also, as just a general, since you do have children, you're going to want to keep the guns locked up in a safe place where they can't get them, and keep the guns and ammo in different locations. And that's the end of it.